Hi, my name is Travis Guzman, and I am here to teach you today on what is breast cancer, how it can affect you and everyone around you. Breast cancer is the most common type of cancer in the world today, and with the US alone, there are 279,000 people who are diagnosed with it each year. I like to teach this because this disease can affect almost everyone in the world, regardless of your race, your nationality, and your gender. There are 4 stages of this disease. There is stage 1, which is curable and requires treatment. This goes along with stage 2 and 3. Unfortunately though, stage 4, there is no cure and the treatments are optional for you. It depends on whether you want to live or not. The main causes for these are age. Your chances of getting it is around 80%, before or after you hit 50 years old, with the earliest being 40 and the latest being 70. The second cause is race. Sure, almost any race can get diagnosed with this, but some studies show that African Americans, they are more likely to be in higher risk of gaining this and are more lethal to this disease. Genetics. It is possible for you to develop breast cancer from either your mother's side or your father's side. The gene mutation that increases cancer risk also has an autosomal dominant pattern of inheritance. Reproductive history. There is an increased risk of getting breast cancer due to your reproduction history. For example, absence of childbearing, early menopause, and pregnancy. Lifestyle choices. You increase your chances based on your personal choices in life, like inactiveness, dieting, certain food consumptions, smoking, and alcohol use. Symptoms. The symptoms are either a lump near your breast or chest, fluid discharge, which is a large amount of liquid substances that come out of your nipple. It can either be blood, pus, or even both. Split pain from your chest or your breast, or swelling due to extra fluid stuck in the skin tissue around your breast or chest. Treatments. Surgery can be quite beneficial. Doing a removal of the breast, lumps, or lymph nodes could help because you are removing the main sources of cancer cells. Medications. The medications that you may get are chemotherapy, chemo pills, and hormone therapy. This may not be the best, but it is almost affordable and is substantial to your treatment regardless of what you are at. Meaning, whatever stage you are at, these could probably be way better for you. Medical procedures. Eventually in life, doctors and scientists have come up with a way of killing off the tumors and cancer cells. What is that, you may ask? Radiation. It helps by shrinking down the tumors and kill all the cancer cells. They do this by either radiation therapy or teletherapy. Radiation therapy is basically them just putting radiation all over through your body, depending on where, or regardless of where the tumors are at and cancer cells are at as well. Teletherapy, it's the same thing except they do it in one precise spot. In conclusion, cancer has come a long way from even before our time. Humans have been dealing with disease since 1600 BC. Before then, the Egyptians couldn't find any way of treating the disease, so people would just die out from it. Nowadays, we have made progress into finding new ways to treat this disease, and it gives us a fighting chance to live longer.